Stop. That's not. It's okay.
My name is Jen Azul Olivet. Student number is 141853200. We're going to do an environment check first. My videographer Patricia is right there. And we're going to hand her the camera. Before we get started, we're going to perform hand hygiene and put on our gloves, as well as wipe down the stethoscope. Taking a minute. Alright, and then we're going to wipe down the stethoscope. Okay. We're going to enter the patient's room. Good evening, sir. My name is Jen Olivet, and today we're going to be performing a head-to-toe assessment. I'm also a student nurse from Seneca College. Is it okay if we can perform the head-to-toe examination on you?
Yes.
Perfect. Before we get started, I'm just going to ask for your, to see your patient ID. Can you also state your full name and date of birth?
William Overton, May 25th, 1931.
Perfect. Before we get started, do you need to go to the washroom?
No.
Are you experiencing any discomfort?
No.
Okay. Patient has given us consent and we can now start with the examination. We're going to provide the patient with privacy. Okay. And we're going to start with patient's physical appearance. Patient's physical appearance, patient's skin color appears to be within, patient's skin color aligns with his ethnic background, and patient's age is also aligned with his, looks to be within his normal age range. Next, we're going to look at patient's body structure. Patient appears to be sitting upright. Patient is relaxed. Neck is erect. There's no involuntary movement. Arms are relaxed. Looking at the patient's behavior, patient appears to be maintaining eye contact with me whenever we are talking. Patient is wearing the appropriate clothing for the situation, and patient's speech is also clear. Patient's mood, we can also say that he's very happy. And again, patient appears to be wearing the appropriate clothing for the weather. Next, we are going to assess patient's breathing. Patient's breathing is involuntary. He's doing it effortlessly, and there is no signs of respiratory distress. Next, we are going to check the patient's level of consciousness. Mr. Overton, can you tell me where we are right now?
Hospital.
Can you also tell me the date?
It is April 2nd, 2023.
And can you also tell me the time of day as well?
It is currently 9 o'clock.
Currently 9 o'clock. Patient is alert and oriented. Patient's level of consciousness, is alert and oriented to 3 points: the time, date, and location. Now we are going to start with the head. So upon inspecting patient's facial structure, patient doesn't appear to have any lesions, no visible signs of lumps, bumps, or scars. We see that there is some skin sagging. And from here, we can also say that the face is symmetrical. Next, we're going to start with the test for cranial nerve number 7, the facial nerve. And what we're going to do is we're going to ask Mr. Overton, can you smile for me, please? Can you smile with teeth? Perfect. Can you frown? Make a sad face. Yep. Can you also puff up your cheeks? Perfect. Can you raise your eyebrows? Yep. And can you open and close your eyes, please? And then we're going to test using resistance. So Mr. Overton, can I ask you to close your eyes? And we're going to try to open patient's, make sure you keep them closed, and we're going to make sure to open the patient's eyes. So Mr. Overton, I'm just going to place my fingers on your eyelids and I'm going to try to open them, okay? Okay. Patient was able to close his eyes, and upon resistance, we weren't able to open it, meaning that the test for cranial nerve number 7, the facial nerve is fully intact. Next, we're going to assess for patient's eyes. From here, we are going to inspect. Upon inspection, patient's eyelashes and eyebrows have equal hair distribution. Patient's eyes are also symmetrical, and again, there is no visible signs of lumps or any swelling or masses. I'm just gonna pull down your lower eyelids to check for your conjunctiva, and can I ask you to look up, please? Perfect. So conjunctiva is pinkish, and the sclera is clear. From here, we can test cranial nerve number 3, oculomotor. So we're going to assess for perla first. We're going to measure patient's pupils. Okay, both left and right pupils are 3 millimeters in size. Pupils are equal in shape, round in shape as well, and equal in size. Next, we are going to do a couple tests, 3 tests. First is the direct light reflex. We're going to shine the light on the patient's left eye first, and when shining the light on patient's eye, the left pupil constricts. When shining the light on the patient's right eye, the right pupil constricts. Next, we are going to perform the consensual light reflex. We're going to place a barrier in between both of the patient's eyes, and we're going to shine the light again on the left pupil, left eye, and the right pupil will constrict. Again, doing it on the patient's right eye. Upon shining the light on the right eye, patient's left pupil will constrict. Next, we are going to do the convergence test. So, Mr. Overton, can I ask you to look at the tip of the light here, please? And when I bring it in forward, I want you to follow it, all right? So we're going to bring it in forward. I'm also going to bring it in backwards. So patient was able to follow the tip of the pen, meaning that both eyes were able to converge and the pupils were able to constrict. This means that the patient was able to complete the task for cranial nerve number 3, the oculomotor nerve. Next, we're going to assess the ears. So from here, we're going just to inspect. Is it okay if I can just move your hair a little bit? Okay, so inspecting the right ear, there is no discharge behind the right ear. We're going to inspect for the left ear as well. There is no discharge on the left ear as well. We're also going to check for the size of the left and right ear for symmetry. Both ears are symmetrical and equal in size. Next, we're going to then assess for patient's nose. Nose is nose is midline, and on inspecting patient's nose, there is no nasal discharge as well. From here, we're also going to assess for patient's mouth. From here, we're going to ask the patient to open the mouth first, and we're going to test for cranial nerve number 9 and 10, the glossopharyngeal and the vagus nerve. Can I ask you, Ms. Orton, can you please open your mouth? And can I ask you to say ah? Perfect. From here, the soft palate was able to rise and the uvula was able to rise as well, meaning that cranial nerve number 9 and 10 is intact. We're also going to inspect the lips as well. Lips are pink and there is no cracking, and it is hydrated and moisture. Next, we're also going to test for cranial nerve number 12, which is the hypoglossal. Mr. Overton, can I ask you to open your mouth one more time, please? And can I ask you to stick out your tongue? Can I also, from here, tongue is midline. Can I also ask you to move it from side to side? Perfect. That means motor function for cranial nerve number 12 is intact. And can I also ask you to say light, tight, dynamite?
Light tight dynamite.
Can I ask you to say it faster?
Light tight dynamite.
Perfect. Patient was able to say light tight dynamite. There's no sounds of tremors, and patient was able to pronounce the we were to hear L, T, and D. Next, we are going to assess patient's neck. From here, we're going to inspect the neck for any. There's no lesions or scars. There's no visible signs of any masses. Skin color is again appropriate with patient's ethnic background, and there is no visible signs of an enlarged thyroid. Next, we're going to palpate. Upon palpating the neck, there is no. Do you feel any pain when I palpate? No. So the patient doesn't feel any pain, and there are no signs of tenderness. And again, there is no. Upon palpating the neck, there is no visible signs of. There's no signs of masses or an enlarged thyroid. From here, we can also assess patient's carotid artery. So I'm gonna just check the pulse. I'm gonna find it right here. Okay, we were able to find a pulse. And we're also gonna assess for the other side as well. Okay. Patient's carotid artery is both equally bilateral. It is 2+, and it is bounding and has a regular rhythm. From here, we're going to assess patient's spinal accessory nerve, which is cranial nerve number 11. Mr. Overton, can I ask you to rotate your head left and right? Next, I'm going to add resistance. So patient, Mr. Overton, can you look to the right, please? Perfect. And I'm going to ask you to do the same with your left. Patient was able to rotate his head with resistance. Next, we're going to do his shoulders. Mr. Overton, can you shrug your shoulders, please? And I'm going to place my hands on his shoulders to test for resistance as well. Patient was able to move against resistance for both his head, when rotating his head and shrugging his shoulders. This means that spinal accessory nerve 11 is intact. From here, we are going to assess the upper and lower extremities. Upon inspecting for the upper extremities, we note that both arms are of equal size and mass. They're both symmetrical in length. There is no visible signs of scars. There's no lesions. There's no bumps. And we can also say that patient's skin color, again, is appropriate with his ethnic background. Now, looking at patient's lower extremities for inspection, we can say that, again, patient's legs are both of equal length. There is no signs of lumps, visible signs of lumps, bumps, masses, any tears or scarring. There doesn't seem to be any visible signs of inflammation on the joints. And we can also say that the patient's skin color is correlated with his ethnic background as well. Next, we are going to palpate the arms. So from here, we're going to start from the top of the shoulders, and we're going to palpate, okay? Mr. Overton, do you feel any pain?
No.
No? Okay. We're also going to palpate for the joints as well. From here, there is no swelling or any signs of inflammation on the joints. Okay, there is no, he said that he doesn't feel any pain, so, and there's no tenderness. We're also going to assess for his right arm as well. Do you feel any pain, Mr. Overton?
No.
No? Again, checking for if there's any inflammation on his right arm. There doesn't appear to be any masses or swelling or any inflammation on the joints. Okay. Again, we're going to palpate for his legs as well, or lower extremities. From here, we're going to start here, and we're going to palpate. Mr. Overton, do you feel any pain? No? Okay. Okay. There's no signs of tenderness or any signs of masses. Upon palpating patient's knee, there's no signs of any inflammation or masses as well. And palpating the left leg, do you feel any pain?
No.
No? Okay. Upon palpating the left, the right joint, there's no inflammation and there's no tenderness. Patient doesn't feel any pain, and there are no signs of masses as well. From here, we can assess the radial pulse. Okay, I'm just gonna assess for, okay. Okay, so from here, pulses are equally bilateral. They're both strong, 2+, and they are both of equal rhythm, regular rhythm, sorry. Pulse is showing to be 76 beats per minute. Okay, from here, we can now assess patient's posterior thoracic cavity. So Mr. Overton, can I ask you to turn around please and lift up your shirt? Okay. Again, we're also making sure that we provide patient with privacy as well. So from here, we're gonna inspect. So patient, again, skin color is appropriate with their ethnic background. There's no skin discoloration. There's no visible signs of lumps, bumps, any masses. There's no scarring. And we can also say that the posterior thoracic cavity is also symmetrical as well. From here, we can palpate. So first, I'm just gonna start off first with doing the symmetrical chest expansion. So I'm gonna ask Mr. Overton, can you please breathe in and out? Okay, one more time. Upon doing the symmetrical chest expansion, patient, upon breathing in and out, the chest symmetrical expansion is symmetrical, and we can say that the breathing is equal on both the left and right side. From here, we're also going to palpate patient's posterior thoracic cavity. So from here, we're going to avoid the scapula. Right? We're also going to feel for any tenderness. Mr. Overton, do you feel any pain?
No.
No? Okay. We're also going to go here. We're also going to go to the other side as well. Okay. So upon palpation, there is no signs of tenderness. There's no masses or any swelling, or there's no inflammation. Next, we are now going to auscultate patient's posterior thoracic cavity. So auscultating, we're gonna again avoid the scapula, and we're going to ask Mr. Overton to breathe in and out. Mr. Overton, can you ask breathe in out, please? Okay, please breathe in out. Breathe in. Breathe out. Breathe in. Okay. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Can I ask you to breathe in again? Breathe out. Again. Again. We're also going to do the other side as well. Breathe in. Breathe in. Breathe out. Okay, perfect. From here, we were able to hear bronchovesicular sounds, and upon auscultating as well, there were no signs or no sounds of adventitious sounds. So this means wheezing, crackles, or stridors. Inspection and auscultation. And now, Mr. Overton, can I please ask you to turn around again? We're gonna assess for your. Just gonna ask that I check your radial pulse one more time, please. Okay, just gonna check for 30 seconds. Okay, upon assessing patient's anterior thoracic cavity, patient's quality of breathing was deep. Again, there was no signs of distress, and the respiratory rate was 17 breaths per minute. From here, we're going to assess patient's apical pulse. So to find the apical pulse, it is found within the mitral valve, and we're going to locate it in the fifth intercostal space. If you don't know where that is, fifth intercostal space, along the left mid-clavicular line. If you don't know where that is, we can locate the nipple, and we can go, this is the landmark, and we can go right underneath, and we will find the apical pulse. So we are going to use stethoscope once again. Again, we're going to go in, and we're going to here. Okay, upon listening or upon auscultation, patient's apical pulse is strong, bounding 2+. It has a regular rhythm. And we also note that patient's heart rate is within 80 beats per minute. From here, we were also able to hear the S1 and S2 or the lub-dub sounds, and now we're going to switch the diaphragm to the bell to hear if there are any abnormal sounds or the S3 and S4. Again, gonna make sure to go underneath landmark. Upon listening for 10 seconds, there is no presence of S3 and S4. So now that we did cardiovascular, it is time to do the abdomen. Mr. Overton, is it okay if we can please transport you to the bed? Upon the bed, we're also going to, again, make sure that the patient has privacy. So when we're draping them, we're not going to drape too far. We're only going to this far. We're also going to use this towel to provide Mr. Overton with some privacy. And we're also going to drape this as well. We're also going to bring it down because we need to get the full abdomen. And we're also going to drape, and we're going to provide the patient with privacy as well. Okay, so from here, we're going to inspect. We note that the patient's contour is flat. There's no signs or visible signs of abdominal distension. There is some striation on his abdomen, but there is no lumps, bumps, or any visible masses. From here, there is some hair distribution on his abdomen, and the skin color as well, again, appears to be appropriate with his ethnic background. We're now going to auscultate before we palpate the abdomen. Oh, actually, before we do that, we're gonna make sure to start from the right lower quadrant and make our way up and down back to the left lower quadrant. Remember, it's 4 quadrants. And we're gonna be listening for vowel sounds. Okay, so I'm just gonna start. Okay. Okay, we're gonna go to, just made our way up to the left upper quadrant. We made our way down to the left lower quadrant. So upon auscultating patient's abdomen, Mr. Overton's abdomen, we were able to hear bowel sounds. There was a high frequency of sounds. We were actually able to hear Mr. Overton's bowel sounds on the right lower quadrant. Next, we're gonna finish off with palpation. So again, when we're palpating, we want to, again, only go 1 centimeter in and circular motion when palpating. We're also gonna check if Mr. Overton has any signs of pain. Mr. Overton, do you feel any pain when palpating? No? We're gonna keep on going. Okay. Keep going to the right upper. Okay. Gonna keep going to the upper. Okay. We're gonna go again. Again, making sure we're only going 1 centimeter. And we're detecting if there's any signs of masses or any bumps or any inflammation. Okay, I'm going to also assess the bladder as well. Okay, so upon palpation, patient doesn't have any, there's no signs of tenderness, there's no rigidity, and patient doesn't experience any pain upon palpation. So from here, we're gonna just, again, take off the towels, and we're gonna make sure we cover him up. And from here, we are done the head to toe assessment.